Did you just finish in me? Well, I already told you I wasn't on birth control, so now you're gonna have to come with me while we get EC. Emergency contraception? You don't know what that is? No, it's not just Plan B. There are multiple options recommended by the American College of Obstetricians and Gynecologists, each with their own benefits and drawbacks. Let me tell you about them, baby. Just listen. For starters, emergency contraceptives are legal and available in all 50 states. Using EC does not cause an abortion. Rather, it prevents pregnancy from even occurring in the first place. It is indicated in situations of birth control failure, such as condom breakage, or in any situation with unprotected sexual intercourse. Obviously, it is most effective when taken shortly after sex. EC does nothing for a pregnancy that has already occurred. There are 3 main classes of EC: the copper IUD, ulipristal pills, and levonorgestrel pills. The copper IUD is the most effective method of emergency contraception at 97%. It's the same as the one used as general birth control. It creates a sterile inflammation in the uterus to make sperm less able to fertilize an egg. When used for EC, it must be inserted within 5 to 7 days of unprotected sex. Because an IUD needs to be placed by a doctor or a trained provider, this requires an office visit and a scheduled appointment. Once inserted, you can then rely on the copper IUD for long-term birth control for up to 10 years. Side effects include increased menstrual pain and heavier bleeding in the first few months of use, which usually subside within the first year. Ulipristal, aka Ella, is the most effective EC pill at 95%. It is a progestin receptor modulator that works by delaying ovulation. It must be taken within 5 days after unprotected sex. Ella requires a prescription in order to obtain. You can also ask your doctor for a prescription in advance that you can fill out at the pharmacy later once having unprotected sex. Regular hormonal birth control can be started after 5 days of taking the pill. Levonorgestrel, aka Plan B, is less effective at 89%. It has a similar mechanism of action, but is less effective than ulipristal, the closer one is to ovulating. As such, it is recommended to be taken within 3 days after unprotected sex, but can still be taken within 5 days with reduced efficacy. Plan B does not require a prescription and can be purchased freely at convenience stores and pharmacies. It's appropriate to purchase in advance or to keep for an emergency, as long as it's within the expiration date on the packaging. Hormonal birth control can be started immediately after taking the pill. Are you getting all this? Good job. For both EC pills, normal side effects include headache, fatigue, breast tenderness, and abdominal pain. You should also expect your next period not to come on time, along with irregular bleeding or spotting in the week to month after taking an EC pill. It is also very important to know that being overweight or obese may decrease the effectiveness of EC pills, with a recommended BMI cutoff of 30 for maximal efficacy. People of any body weight can take EC pills, but ulipristal has been shown to be less effective in people weighing more than 195 pounds, and levonorgestrel less effective in people weighing more than 165 pounds. As an alternative, copper IUDs are effective in any weight. No specific follow-up tests or procedures are needed after taking EC. You should have a pregnancy test if you've not had a period within a week from when you expect it. If you are already pregnant, EC pills have been shown not to harm the pregnancy or the health of the fetus. And there is a fourth method called the USP regimen, which involves taking several doses of combined oral contraceptives, ethinyl estradiol, and levonorgestrel, traditionally used as birth control, but it is overall less effective than taking levonorgestrel alone, and therefore less commonly used. The World Health Organization has preferred the three that we talked about over the USP regimen, but it can be utilized in situations where no other alternatives are readily available. Got all that? Now, let's get going, and then you can have your way with me.